Good morning. Part of my research focuses on how people use, how they understand, process, and actually apply comparative information to choice. So that's the lens we're going to use to look at some of these issues. We've heard a lot this morning about the complexity of the choice, and so I want to think about this in terms of actually how people make choices. They need to be able to understand the meaning of the terms, which we've heard a lot about this morning is a problem. Process multiple pieces of information, as well as different types of factors. Think about their own personal situation and apply it. And then the most difficult of all is to differentially weight factors according to their own preferences. And think about all the different factors we're talking about. We're talking about multiple cost factors, coverage factors, network factors, and for some exchanges and soon for all, the quality of the care provided in, that's a lot of different things to make trade-offs and to differentially weight. And then finally, we have to bring that all together into a choice. So these kinds of decision tasks are difficult for human beings. We're not really wired up to do this very well. And of course, the burden is greater for people who have literacy and numeracy challenges. So how do people respond when faced with this kind of complexity? The most common thing is simply to take a shortcut. And usually that shortcut is to decide on one factor. And it's usually a factor that people understand. And in doing that, in taking that shortcut, individuals often undermine their own self-interest. But what we've learned from decades of research now is that the way the information is presented can help overcome some of these difficulties. Not everything, and maybe not that last mile of consumers that we're trying to get, but it can make a difference. So the categories of strategies that help people use comparative information, just simply reducing the cognitive burden. And that could be by reducing the amount of information, and I'll share with you some of the strategies in that direction. And of course, using plain language so people can understand what the words mean. But we can also use some small nudges to help people use the information to draw their attention to things that they often overlook. And I'll give you some examples of that. And we can actually interpret information for people. For example, putting a good-bad scale onto information, that really does help people. And then we can even go so far as to call out best options. And so I'll walk you through some examples of each of these. So some of the studies I'm going to share with you are based on a recent study we did with funding from the Coquinas and Giovannis Foundation, where we looked at information commonly presented in the health exchanges, and we looked at how people did who have different numeracy levels, and we looked at different ways of presenting the information and how that affected their choices. People were randomly assigned to different ways of seeing the same information, and we looked at how that affected their choices. So this is just an early look at how do people with different numeracy levels understand the words that are often used in the exchanges. And this is the language around cost. And as you can see, people who have lower numeracy are less likely to understand these terms. And numeracy refers to the ability to derive meaning from numbers. We showed people a pretty simplified version, not as complicated as what you would see in an exchange, looked at their numeracy, and we were looking for choices of that reflected high value. That is, that the quality was good and the cost was reasonable. And again, it was a simplified data display, and we did see a real difference in numeracy impacting the ability to make a high-value choice. But we also saw that nudges and strategies that reduce the cognitive burden did help both high and low numeric consumers choose high-value plans. So in one experiment, we looked at what happens when you just summarize information. You don't give, at least at the top level, a lot of detail. So you summarize maybe premium and total expected costs versus detailed. And the detailed might be 4 different cost measures. It helped people choose high-value plans. When we showed, we also looked at how just the placement of information made a difference. So we showed we saw some exchanges were reporting on quality of care in the plan, and some of them put the information next to the plan name. Some of them put the information next to the cost information. Well, it turns out that makes a difference. It's kind of like a nudge, because it's if you put the information, the cost, and the quality together, people are more likely to actually use it and pay attention to it. And we saw that in the experiments. Now, one of the things that we did see in looking at the exchanges and the kinds of choices that people were making, and lots of researchers have reported on this, people tend to make decisions based on premium alone. And what we observed is that people with poor and fair and poor health also are making decisions on premium alone. That's probably undermining their self-interest. Because their costs are going to be higher unless they pay attention to some of the other cost factors. So we looked at some experiments where could we draw people's attention to, for example, their estimated total costs, not just premium. And so we looked at we looked at different ways of presenting that and how that would affect their choices, whether they would be considering the total cost of care. Here is one experiment where people, I don't know if you can see that, but there is a monthly premium, maximum out-of-pocket cost deductible, and yearly estimated costs, and there are 7 plan choices. Pretty complicated, but simply ordering them on estimated yearly costs increased the number of people who made that choice based on not just premium, but on their estimated costs. So it was kind of a nudge to consider something beyond premium. We did another experiment where we looked at the amount of information as well as the placement of information. And here, again, is the same data points. One group saw this. One group saw less information, but they saw the premium and they saw the yearly estimated cost. And another group saw all 4 pieces of information, but displayed differently. So the deductible and the premium are kind of tucked under the plan name, and that drew less attention, essentially, to the premium. And more people, even with the 4 pieces of information, when the information was presented in columns, more people, in 2 columns, excuse me, more people made the choice on the estimated lower cost. So these are examples of ways, especially when we know that there are common decision errors in how people use information, there are ways to counteract that by the way the information is presented. This is just a simple example of calling out best options. This really helps people. It's difficult for information purveyors to do this, and it can be done with a web-based decision tool, but it helps people. It's not any additional information. In fact, we did experiments where we didn't have that final column, and it helped people to identify choices. You're essentially doing the cognitive work for the individual. And you're drawing attention to best options. And this is what Consumer Reports does. They help people in this way. So we are moving into an era where we're going to be reporting on quality, and I want to show you an additional way that we've learned in research that helps people use this information in choice. And it's the use of word icons, and it helps people by reducing the cognitive burden. It highlights and actually interprets meaning, and it makes it easier to identify best options. And what the word icons do is they kind of map a good-bad scale onto information. It's a symbol that has a shape and a color, and it has a word embedded in it. So you don't have to keep information in your mind as you consult a legend. It's all inherently meaningful. The best data displays that are comparative, where people are trying to make a choice, are ones where they can identify the best options in a few seconds. Because for many consumers, that may be all you have their attention for is a few seconds. So I'll show you some examples here, and you'll see the difference. Here we see a lot of use of stars. People know what stars mean. They're used to seeing them in lots of consumer sites now. But you have to work kind of hard to figure out, okay, what's the best option here? And we see that what we've observed in studies is that the heuristic that people use in making these kinds of choices is they just add up the good symbols, whatever they are. So you can do that with the stars, and you can figure out what's the best option here. But if you use the word icons, the answer will pop out at you much easier, not so much work. So that's the strategy. That's what you want, is an approach that allows the individual to very quickly see best options. They're more likely to use the information. That's the bottom line. So essentially, everything that you can do to make the task easier means more people will incorporate information into choices. And these strategies actually help everyone, but they help those with less skill the most, because those with less skill rely on these kinds of approaches more than higher skilled consumers. So I see I left a word off here. It's supposed to be onus on the information provider, but let me sort of explain this. So we can think about what I've been talking about as kind of continuum. where at one end of the continuum, you just have, okay, you give information to people, you don't translate it, you don't interpret it, and that's what a lot of health exchanges do. And that's where we kind of started with the whole comparative quality information. It was just a transfer of information. It was not any interpretation. At the other end of the continuum, you have the navigators, or you're not requiring the individual to do all of the work. And in between those two continuum ends, you have these other strategies that can help a lot of people. And they start with kind of reducing the cognitive burden, and that can be done with standardization, narrowing options, and using plain language. There's lots of ways to reduce the cognitive burden. But we can also help people by putting more meaning on data and helping them by putting a good-bad scale onto information. We can use small nudges where we know that people are more likely to make decision errors, and draw their attention to information they're likely to not actually use in their choice. And then going even further to the right, we can highlight best options through the use of decision tools that help them either based on their own stated criteria about what's important to them, or based on their characteristics. So, for example, if they have poor health, their best options may not be to rely on premium alone. So, at this point, what we see, most of the efforts on reducing the cognitive burden, they're in that first bucket, where we do see that there's an effort to use plain language, an effort to standardize and to provide the ability to narrow options. We see much fewer efforts that use these kinds of nudges or interpret data for users. I want to go back here. So basically, the further right you move on this continuum, the more responsibility the information provider is taking on to interpret and even call out best options, to do small nudges. That's all a greater burden on the information provider, or more resources, as we talked about this morning, that it takes a lot of resources to provide that face-to-face navigator help. So, what strategy do you employ, and what should be considered when? So, if we want to move to the right on that continuum, is when the decision task is very difficult or complex, when the skill level of the users is lower, when common decision errors are known and can be countered by nudges, and when the stakes involved in the choices are high for individuals and for the market or society. I think ultimately we want to be able to move to a more evidence-based approach in how we provide information to consumers so that we know it is more likely to be understood, processed, and actually applied in choice. Thank you.